program, right? The order of the speaker.
Yes.
Mustafa Kufali, Byron Ernesto, Agustin, Laszlo, Dario Liberona, Juris, Habib, Hector Perez, and Birte.
I'm still not sure if Hector from Mexico is here because he didn't reply, but I have some participants from Mexico. So if he's not there, it's okay. I think we'll pass.
Okay, I will come by.
Today.
I will call by the country. Okay, so I will call by the country and I will give the answer.
Okay. I think we can start now.
Okay, I think we should all switch off a video and microphone probably.
Yeah.
If you. Riri, do you introduce, right? You start. Riri, I can't hear you now.
Should I unmute?
Something
okay,
happened.
Thank you. Right, I'm fine.
Okay, will you start, Riri?
Okay, I will say good evening, everyone. Hello from Jakarta, Indonesia. I'm so pleased to meet all of you tonight. We have 150 participants registering from 40 countries today, and we have 9 speakers from Professor Kufali, Director of Bülent Ecevit University from Zonguldak. We have Birte Horneman, Data Strategist Architect from Aalborg University, Denmark. We have the Secretary of the University of Indonesia, Dr. Agustin Kusumayati. We have Mirko, which going to introduce us. He is from Bologna University. He's the Vice Rector, and he's also going to moderate. To be the moderator of this meeting, and Dario from Chile. Wow, we are so rich with a lot of really good speakers tonight. And on behalf of UIGM Metric World University Ranking, I would like to wish you all a good conversation and a good sharing tonight, hoping that we can learn from each other to combat this COVID-19 and the transition towards the new normal period in our world, in which we are going to provide the new method of teaching, learning, and working. And I hope that we can learn from each other today. And without any further ado, I would like to invite. Okay, I also would like to introduce you to 3 executive board member of International Ranking Expert Group Observatory, IREC. Mirko from Bologna University, Habib Fardun from University of King Abdul Aziz from Riyadh, and also Miss Dr. Birte Horneman from Aalborg University, Denmark. And hello, Dario. Thank you so much for being here also today. And also the rest of the speakers and all friends from all over the world that I cannot say hello to, but I'm sure that you are ready to have the next conversation. And please ask questions in the chat room. Without any further ado, Mirko, time is yours. Thank you.
Thank you. Thank you very much from Bologna, from Italy. I hope you can hear me well. And I will speak slowly, by the way. And I would like, well, first of all, to thank Professor Riri Sari and all the Green Metric for organizing this, all the national coordinator, which are giving their contribution to this meeting, and of course, all the people listening now. Before we start, immediately, let me say that there is no doubt that the COVID-19 pandemic has had a big impact on all our universities. And this impact touches all the dimensions: teaching, research, but also administration and our internal process. And of course, each university has reacted in a different way, also because different context of the pandemic. In Italy, we had a big hit, and we had to move quickly. And everyone reacted in a different way. And I think that it is already very interesting to share what we have done and how we face the problem, and how we face the problem of finding a sustainable way of reacting to the pandemic. But I believe, if the speaker agree with me, that there is also another important point to keep in mind, is what we are going to bring with us of what we have learned during this emergency. If and how this emergency, very, very tragic, can be turned into innovation. At least here in Italy, we were able to do things about our internal process that it would have been impossible in years. So probably something will be left. Something going back to normality will remain in something that we have learned about new and sustainable way of doing teaching and research. And of course, there are also some risk, if I think about mobility, to our sustainability process. So by thanking all of you to participate, we will start. I would suggest that we turn off the video and the sound. Only the people giving the contribution can keep the video on. Each contribution will be 10 minutes. I will take care of the time. And then at the end, we will collect suggestions, questions, remarks, and we will start a discussion. So without hesitation, I would like to share with you the experience we have in teaching, learning, and working during the pandemic in our university. And I will start immediately with Professor Mustafa Kufali. I apologize with all the speakers for my mispronunciation of her name in advance, from Turkey. And then we will move to Ecuador. So please, the floor to Turkey. Thank you very much.
Hello from Turkey, Zonguldak. I hope you are doing well, you are fighting well against COVID-19 in this term. And I hope we will get rid of this COVID as soon as possible. My topic is teaching, learning, and working in Zonguldak Bülent Ecevit University during COVID-19 pandemic. And I'll share with you, sorry for this one.
Do you need to share some slide?
Yes.
Probably.
No.
Okay. Okay.
Can you see my slides?
Yes. Yes.
Okay. Sorry about. Okay. Firstly, I want to make briefly about the situation of Zonguldak Bülent Ecevit University. Zonguldak Bülent Ecevit University is among the leading higher education institutions in Black Sea region of Turkey, offering high quality education to more than 35,000 students. It was founded in 1992. However, the history of university dates back to School of Mining Engineering that was founded in 1924. We have 14 faculties, 4 schools, 9 vocational schools, and 3 postgraduate institutions, and 33 application and research centers. Zonguldak Bülent Ecevit University has 12 campuses located in towns of Zonguldak province. We have 1,271 academic and 21,167 administrative staff. Zonguldak Bülent Ecevit University centers its activities around 3 mottos. These are high quality education, service to society, and internationalization. We consider service to society a priority, and in this respect, protection of the nature and resources, saving energy, and environmentally friendly settings and infrastructure are closely linked with our university's mission. We are the health base of Zonguldak and the entire Western Black Sea region. We have a research and application hospital, a dental hospital, an obesity and diabetes research and application center. We have, as you see, we have the largest and comprehensive hospital in the region. The hospital has 610 beds, 59 outpatients clinics, 27 clinics. The hospital serves around 590,000 patients in outpatients clinics, 55,000 patients in emergency service, 37,000 in patients annually. Zonguldak Bülent Ecevit University has the most comprehensive dental hospital in the region. This serves around 115,000 patients annually. We have also obesity and diabetes application center. This center has, we have the first obesity and diabetes center with a separate building in Turkey that was belonging to the state. Now we can turn to the summary of COVID-19 pandemic in Turkey. The population of Turkey is approximately 84 million people living in 81 cities. Turkish Ministry of Health and Ministry of Interior Affairs have taken effective measures to fight against the pandemic. Since the first case was recorded, the pandemic has always been under control. Turkey has a considerably low death rate among European countries. The first case was reported on March 10th. Number of infected patients increased steadily until April 11. The peak number of detected cases on April 11 was 5,138. After April 21, remarkable decline in number of daily cases was recorded. You can see on the screen the case of pandemic in Turkey. Now we can turn to the Zonguldak province in our, that Zonguldak is our town. Okay. The population of Zonguldak is 596,000. We have that number. Zonguldak has considerably been affected by the COVID-19 pandemic. Until June 7, 820 total cases have been reported. Unfortunately, 63 deaths have been recorded, and 675 patients have recovered. You can compare the figures, numbers with Turkey and Zonguldak on the screen. We can turn to the measures taken against COVID in Turkey now.
The time नहीं है ना
Okay. All schools were closed. All on-campus teaching activities were stopped on March 16th. Seniors above the age of 65 and children below the age of 20 were banned from going outside. Traveling to and from 30 big cities, including Zonguldak, were banned. On weekends, national holidays, including Ramadan, Eid al-Ramadan, lockdowns were announced for 30 big cities and Zonguldak. All schools, restaurants, cafes, mosques, barber shops, shopping malls, and places where crowds could gather were closed. In state offices, a minimum number of employees kept working on the premises. Many staff continued working online from home. In Zonguldak, strict measures were taken in Zonguldak along with big cities because Zonguldak is a mining city with a high number of retired seniors with COPD and various lung diseases. The infection and health rate of COVID-19 were above national average at the beginning of pandemic. Actions taken by Zonguldak Bülent Ecevit University during COVID-19 pandemic. I'm sorry for technical difficulties because of the long distance. Online education on campus teaching was stopped on March 16. Online teaching was planned and immediately put into action by Distance Education Application and Research Center. Teaching is continuing in virtual classrooms where students and instructors effectively interacted in live or asynchronous classes. All instructors are actively communicating and interacting with students. Homework, projects, and tasks are being assigned, submitted, and checked online. Sorry about it. All midterms, final exams, and makeup examinations are carried out online successfully. The University Distance Education Application and Research Center has been fully and effectively operational between March 20 and May 5. More than 1,200,000 250,000 students logins were recorded. The average number of daily logins are approximately 30,000. 25,000 documents were uploaded. More than 3,000 homework were assigned. More than 4,000 live lectures were held. Online education. Since the beginning of the pandemic, Zonguldak Bülent Ecevit University Hospital has bravely fought against the virus. A pandemic management committee has been formed and all required measures have been taken. A special inpatient clinic has been opened for the virus. Inpatients are treated in specially isolated single rooms. Separate ICUs are arranged and assigned for COVID patients. Treatment of patients is continued in a safe and comfortable environment until May 21st. More than 10,000 tests have been performed. More than 1,040 400 patients have been monitored in quarantine in their homes. Total number of patients is more than 400. 127 of them were treated in ICU. 4 patients have been treated with blood plasma. You can see the pictures from our hospitals. Visor production for health staff. The university has a student group named GRIZO 263 Space Team. This team has ranked second worldwide twice in CanSat model satellite competition. They are going to send a mini satellite into the space in December this year. This team is sensitive to the pandemic. The space team produced masks and visors with 3D printers. They distributed them to doctors, nurses, and health staff working at our hospital.
Okay.
GRIZO team also played a significant role in handling the pandemic. Inhalators are vital in treatment of COVID patients in ICU. This team produced duplicators for inhalators with 3D printers. They delivered them to the hospital. You can see the pictures.
Thank you, Mustafa. Can we move toward the end? So it will be. Thank you. Thank you.
Let me summarize then. We have. Can you give me a couple of minutes?
Of
Is
course.
it possible?
Please.
Okay. Okay. We produced also mask and produced refreshments for health students, for health services. You can see the pictures. And we have some meetings about the pandemic in the town and also at the university several times. We have some informative meetings about the pandemic at the university and in town. You can see the pictures. We visit to the hospital. We have online examination of patients at University Dental Hospital also. We take some measures. You can see on the on the screen. I don't want to spend more time for this one. All buildings are being disinfected regularly. We have medical waste containers, hand disinfectants, and protective panels for security staff. Current situation, this is final. On June 1st, all staff started working on campus. Online education is going to continue until September. Many common places are gradually opened. Currently, the central library, one study hall and hospital canteen are operational. In Turkey, there is a sharp decline in number of active cases. In Zonguldak, a minimum number of cases is being recorded. Only a few new cases are recorded every week now in Turkey and also in Zonguldak. Thank you very much for your attention.
Thank you, Mustafa. Very, very nice. Thank you for sharing your what you did in Turkey. It's very, very interesting. If I can make a suggestion for the next speaker, I will focus, as it was very interesting, on the second part, on the impact. You can skip eventually some part of the presentation of university to save time. And then I also ask, but at the end also to Mustafa and the other, how they are thinking about what it will be their teaching, for example, after September. But now I will move, thanking again Mustafa, I will move to the second one. We go to Ecuador, to Engineering Byron Ernesto Vaja Barahona. I hope I said almost correctly. So please, Ernesto, the floor is to you to share the experience from Ecuador. Thank you very much. Ernesto, I cannot hear you and I don't see you. While we check for Ernesto, I will move on to, if you agree, to Indonesia.
Sound is off.
Yes. Hello?
Her sound.
Ernesto? I guess we have some problem with connection. I don't know if it is just me.
No, her.
Okay. Good morning. I think we were having some problems with the sound. Can you hear me now?
Yes, now I can hear you.
Okay. Good morning. Unfortunately, our president couldn't be at the meeting because he was called upon by the local authorities, but I'm the director of international relations, so I'm happy to speak on behalf of him, and thank you for the opportunity.
Thank you.
Okay. Thank you for Professor Riri Pitrisari and Universitas Indonesia for hosting this webinar in such a challenging times. So I'll move on with my presentation.
Okay, thank you very much. We see it.
Okay.
Please turn off all the microphone except the speaker. Thank you very much.
Thank you. I'm having some, okay. So I'll speak briefly about our university. Um, and how we've been managing teaching and learning and also working at Escuela Superior Politécnica de Chimborazo. This has been challenging times, and we've learned a lot of lessons that can be turned into opportunities to build a more inclusive, more collaborative, and resilient higher education system. This crisis has challenged the creativity and innovation capacities of higher education institutions and education systems across the globe. I'm sure that we will emerge with new learning dynamics, new capacities, and a new vision that cares more not only for the environment as we're green universities, but for those less advantaged students and communities in our areas of influence. So just to tell you a little bit about the university, we are located in Ecuador, and we have 2 branch campuses and 6 experimental stations. Something that is unique to our university is that we have stations in the Amazon, the highlands, and also the Paramos. And those are living laboratories, and they are also home to endemic and native species in each of the regions. They have been declared conservation areas. And we also serve most of the population. They are 70% students from outside the province. They come from low-income households, which means that they are not all of them have access to internet, which has been a really challenge. But I'll tell you in a few minutes how we handle that. So just to see a brief overview of how the pandemic situation in Ecuador is, we have now, as of Sunday, 43,000 cases. Unfortunately, 3,600 deaths. But the epidemic curve reached its peak in March, but it's now flattening, and the rate of severe cases have been reduced, and now they can be handled effectively by the healthcare system. This is a brief outline of what are the main focus of this presentation. So our measures have been focused on mainly in 2 areas, which is the sanitary measures that we took to contribute to not only to the university community, but also to the local authorities and the local community. And also the academic actions, because all the universities were forced to move on to remote systems of learning, which has posed many challenges, to say the least. And also at the end, we'll see how we look at the challenges and new opportunities that this pandemic can bring. Among the measures, like maybe many universities, the contribution from research to mitigate the pandemic was the manufacturing of printed face shields. And also, SPOCH participated in an open call for universities and companies to help with masks and also respirators. So SPOCH won the first prize. And also, you can see here what we've been doing with helping mainly the community, because the university closed on September 16. So as I said, SPOCH won the first place on this innovation challenge. It was addressed mainly to provide support and resources for the health system and also the communities. But the main challenges that we've been facing is that that we were not prepared for, as many other universities, for a situation like this. So what we did, we were fortunately to have been to have had maybe 40% of our faculty using already online tools for teaching. But then the other thing is that our university was the first university that opened in the country. So we were the guinea pigs, we may say, at the time of start implementing measures to address the pandemic. So what we did was mass training on faculty of Teams and Office 365. Those two systems are. There was a mass training for teachers, faculty. For faculty, staff, and students, so we can all use the same system and be connected at the institutional level. Also, we bought the Moodle platform, so there were templates that all the institutions could use to have the same type of methodology for teaching and learning. So faculty, they were trained in how to use these virtual course templates. But the most important measure, I think, it was the use of they bought the Moodle license for mobile devices. As remote study requires a good quality of connectivity, which is not always available for students, especially for those with limited resources, Spoj purchased this license so students can download the course contents in their cell phones. It's worth noting that the rates of mobile devices in Latin America are extremely high, and sometimes they exceed more than one cell phone per person at the population level. So this, without a doubt, was an opportunity, or is an opportunity for higher education institutions to take advantage of. So Spoj focused the efforts on solutions and contents to be downloaded on mobile phones. There is also a campaign for online tutors. So the key thing is training for faculty and professors, because they are not all of them prepared, but that's the key for us from the vision of our president and the leadership is to train faculty and also take care of the needs of the students. So in the future, the university is looking at supporting the students with maybe internet packages, or trying to see the way that they can have good access and good signal for internet. Because as I told you, most of the students are from outside the city, so they are in remote areas. And also, there is a campaign to promote MOOCs, massive open online courses. Sometimes it's difficult because of the language barrier, but all the time there are more MOOCs available in our languages. So we are working on a campaign to put all these resources at the help of the students. And also international cooperation. That's we're trying to promote all the agreements that we have with universities, and make use of the webinars and all the resources that we can share now. For example, we have agreements with many universities around the globe. So we did this webinar, we hosted this webinar with universities from China, Canada, United Kingdom, Spain, in Europe, China. So using the tools that the virtual resources can be very, very helpful. So I would like to talk about the challenges that we think that are more pressing on what we do, because this sudden and rapid rise of the pandemic forced the higher institutions to introduce simultaneous responses for which most of the education institutions were not prepared. So these often new and untested methodologies and practices relied primarily on the willingness and the capacities of faculty and professors. So many of those had to innovate and act on the spot, but the work of the university is doing is trying to provide those faculty with their resources and also with the tools and the knowledge, the training that they need to move on. So I think that the challenges that most of the universities will face will be minimize the impact on the learning of students, how to keep them engaged. Many of the students have difficulties to continue their studies in these no traditional modalities. So we need to be aware of that. We need to keep them engaged and just see that they learn. So we need to focus also on learning outcomes. It's difficult to sometimes to measure, but that's a thing to work on the curriculum, on the internationalization at home. We're building a strategy so we can work on the straight on the curriculum and see how to incorporate all those learning outcomes into the curriculum and online learning, and trying to bring the world into the students at home and now virtually. That's what the main challenge, and also how to address and mitigate the digital divide, because we all know that the students that have the less resources are being the most affected. So that's a challenge, and that's something that our leadership, they are working very hard on that. And also,
Please switch off the microphone. Sorry, but
okay.
Thank you. Please, you can continue.
Yeah.
Close.
Okay, another one of the challenges is how to mitigate the effects of the public spending cuts that all the governments, especially in Latin America, we are facing these public spending cuts. So now we need to use the money wisely. And that's something our leadership, they are also working on that. So I think investing in pedagogical training and how to get more tools for online learning will be the key. Those will be ahead of the game. And also we can talk about how we guarantee the integrity of testing, of how we know that the students are learning in the same way, or how to also validate the results of testing online. I know that there are some universities that are experiencing, I know, this ethical dilemma of privacy, and also how we keep the liberties, while sometimes through a computer they are checking what you're doing, what you're checking, because they need to make sure that you are attending a class or you are taking a test without cheating. So those are big challenges, but also the opportunity this crisis presents. I think it has to be used to launch another type of higher education institutions. We must rethink what a good pedagogy is, and how to adapt to this environment, to the new learners. And I think if we, all the flaws and all this pandemic brought, we have to look at this as an opportunity, and for a long-term outcome, not just because of being reactive to the pandemic, but to be ready for the long-term challenges that this presents. So I think all of what is going on, it was already happening, but it has been accelerated by this pandemic. So online learning, more focus on internationalization at home, on internationalizing the curriculum, this new type of methodologies like blend or hybrid learning, and it has been just accelerated by the circumstances. One of the opportunities, I think, it's just the use of technology. They cannot be underestimated, and also we need to develop more flexible modes of learning, so we can have so marginalized groups can have more access to these new methodologies. So universities have to be mindful of how to provide that access to our students, the one they need the most. Also, it's a very good opportunity to strengthen our networks of collaboration like this webinar we're having now. It's a very good example of how to use that collaboration that we have. And also strengthen the internationalization of research, because considering the interdisciplinary nature of knowledge production, increased collaborative research for institution is crucial, and we have the means and we are experiencing how to use them. One thing I think it's certain to end is the new normal that, as people say, will not resemble the old model of higher education. It's not, probably it's very unlikely that we are going to go back to the pre-COVID-19 way of doing things. And I think, and I hope that this current disruption we use to enrich the landscape of our systems of higher education. And I think, just to end, a quote that I would like to say is that we should never waste a crisis. We should learn from it. It's a citation from Winston Churchill that I think it's very timely. Thank you.
Thank you very much. I completely agree with your conclusion. Congratulations also for the academic action, for the formation and the use of Moodle on the mobile, but probably we will have a chance to discuss later. Now I will move on to Indonesia, again asking to all the contributors, they're all very interesting things to say, but please keep in mind the 10 minutes time, because we have all other colleagues who want to share their experience. I will move now to Indonesia with Dr. Augustine Kusumayati. I hope it's almost correct. Thanking again Ecuador. Let's move to Indonesia. Augustine, are you ready?
Yes, I am.
We don't see you. Oh, yes, now we see you. Thank you very much.
Okay.
Please, Ecuador, you can switch off the video. And please, Indonesia, thank you very much for sharing your experience.
Okay, thank you so much, Mr. Chairman. Ladies and gentlemen, a very good evening from Indonesia, maybe morning in other sides of this, our only one globe. It's really an honor for me to share the experience of our university, how we prepare ourselves in as a response, as our response to COVID-19 pandemic. So my presentation will be covering some issues. How are we going to prepare, or how we are now preparing ourselves for a new normal life? Until now, we are still implementing working from home, studying from home. We are not opening our campus yet, and we are waiting for the decision of our government. When are we allowed to where are we allowed to open again our campus? But now we are preparing ourselves to open our campus and start a new normal life. So first of all, I want to share with you our idea or our concept of what we call as a new normal life. First of all, when we are talking about controlling the COVID-19 prevalence or transmission in our campus, we have to see that the disease or the health issues is not standing alone in our life. So health itself is defined as a complete physical, mental, and social well-being. So in this case, if we maintain ourselves in the lockdown situation, then we do not have a good social life. So in this case, we have to think how we can change the situations so that we consider both aspects or all aspects of human life. It's not only health consideration, but also social and economic considerations. This is a concept of public health because my background is medicine and public health, and we believe that the health status of human is influenced by so many beyond health determinants. So in this case, we cannot think only about health and forgetting about economic issues, for example. This become a very big issues in our country because when we are doing a lockdown in many provinces and districts in our countries, then we have problems with economic activities and also the economic situation of our people. So in this case, we are thinking about how we can start a new normal life with, of course, a new standard and lifestyle. So, so in this case, all development sectors in Indonesia, we have to have one shared goal. The shared goal is the healthy, productive, and prosperous people. So in this case, we cannot only thinking about health and then forget about other aspects of human life, but we have to think in the comprehensive way, all aspects of human life. So the other thing is the idea that now we have to live together with COVID-19. When we are talking about live together with COVID-19, in this case, we revert to a very old theory from John Gordon that living together with a disease, meaning that we are living in a balanced situation. That means the agent of disease is still there, but they are not causing any problems with us. Maybe some of us still get the disease, but it is not a pandemic right now. So when we are talking about living together with COVID-19, it means that we can control the disease. These are some examples of diseases that stay together with us in daily life, but we can control them. So this is the situation that we want to have with COVID-19 also. So in this case, we have the concept of new normal life. New normal life means that humans and virus of COVID-19 live together. It means that we can control the disease. The second, that we apply a new standards in various aspects of life and daily activities, aiming to prevent COVID-19. And then in this new standard, we apply technology, ICT, information and communication technology, artificial intelligence, Internet of Things. Those things should be used to support our new standard of life. And then the fourth one is new normal means that we focus on behavior change of the people. The new normal is not simply lifting the restrictions. No, new normal is not back to old behavior or lifestyle before the pandemic. It's not abnormal. And of course, it's not unhealthy and risky behavior. We cannot have the new normal as a short notice. We have to make a very fine planning with a very clear intervention to change the behavior of the people. And then we have to differentiate between the new normal at the individual level and the new normal of the community or institution. Right now, everybody as an individual has already applied a new normal. But as a community, we have to consider many things to start a new normal, to start a normal life. So this is what we call as a new normal. This is what we are thinking about new normal life. It's a new lifestyle and a standard of living that is triggered by COVID-19 pandemic that enables humans to live healthy lives, carry out their social roles and functions, and be productive as to create a noble and prosperous life. This is the new normal. So these are the preparation that we do in our campus. First, we refer to a very basic concept of the 5 level of prevention. So we do the health promotion, we do the specific protection and disease prevention, and we do early diagnosis and prompt treatment. And if disease already occurred, then we send to the hospital. But at the campus, we have to do these three first and secondary prevention. So we will focus on the 80% healthy people to prevent them from getting the disease. And the WHO provide us with the guidance of the 6 criteria for countries to consider lifting restrictions from controlling transmission, strengthening health system, controlling the outbreak, preventive measures in special public places, and control the imported risk and cases, and community empowerment. So in this case, when we are preparing to have a new normal life in our campus, we have a comprehensive arrangements of these 6 aspects that proposed by WHO to be used, and then the principle of the 5 level of preventions. So let me now introduce or present some measures that we are preparing now, and we are making us ready for the new activities in our campus. First, about transmission control, we developed the protocol for individual precautions. For example, how to improve immunity, healthy lifestyle, balanced diet, physical activity, and then how to do special or specific protection and disease prevention, using masks, washing hands with soap, physical distancing, avoid crowd, for example. Those things are put in the protocol that should be referred by everybody in the campus. The second is how we control the people density rooms and classrooms. In this case, we apply, for example, blended teaching and learning. So only half of the student in one class only stay in the class, while the other half or the other 2/3, they have to follow the session of by long distance, by online. So this is the blended teaching and learning modes. And then we apply new standard in laboratory work. For example, if in previous time, in one session, in one laboratory can be, let's say, 20 students in one session. Right now, we only allow half of the original capacity of the laboratory. And then we apply the work from home scheme. And then also we apply new environmental health and sanitation standard for places where people will come. These are some adjustment in teaching and learning. Besides apply blended or dual modes in teaching, we strengthen also student-centered active learning, because by applying student-centered active learning, we will reduce the session that we need to do a face-to-face session with the students. And then we apply new standard in laboratory work with a new protective devices, with a new density in one session, for example. We modify also field work because we want to avoid crowdness in doing field work. And then we apply new standard in clinical work. This is very clear one, especially we just opened our dental hospital with a very new standard of working in the dental hospital. We apply also dual modes in thesis or dissertation exams. Can be face-to-face, can be maybe some others prefer to do online in examination. So it's possible. And then for the entrance examination, we will conduct in this July online web-based entrance examination. So the other things that we are doing and they are preparing is strengthen the surveillance systems. So how we can detect, test, isolate, treat, and trace the risks and then possible cases within the campus. The surveillance system already developed since March, when we have the first phases of cases in Indonesia, and now we are improving the system by applying a new application that we apply to all the students, that we can monitor the risk of every students and staff of the university. The outbreak prevention in special settings. These are special settings that we have in the campus. We have teaching hospital that is become referral hospital and lab for COVID-19. We have dental hospital, primary care clinic, laboratories, dormitories, guest house. So these are the specific settings that we develop a specific awareness and preventive protocols. The next is we are developing preventive action to prevent transmission in several public places. For example, the train stations. We have 2 train stations within the campus in Depok. Bus stops, campus bus. Ojek is a motorcycle, a public motorcycle. Restaurants, canteens, toilets, mosques and praying halls, classrooms, libraries, bookstores, service units, sport facility, and faculty clubs. So we are developing protocols for these all public places, so that these public places will not be a place of transmission of the COVID-19. And then we develop also a procedure to control imported risks and cases for guests, for UI staff and students who are going abroad or going to other provinces in Indonesia, and then for UI staff and students who are just returning back from abroad or from other provinces in Indonesia. This is the part of the surveillance system that we have developed. And then the last but not least is communication, information, and education for all the member of the university, the staff, the students, and also those who are working in the campus area. For example, those who are working in the restaurants, in the canteens, in the bookstores. So everybody are targeted of this program. So the other thing is I want to share the 2 principles that support all the system. The first one is apply technology. These are the things that we do with the support of technology. Teaching and learning, very clear. Working, we are using e-office now. We use e-signature, for example. So we do not have to come to the office just only to sign a letter, for example. Of course, there are documents that should be signed and cannot be signed by e-signature, but mostly we can do e-office. For delivering and disseminating health messages, for doing surveillance, telemonitoring of the staff and students at risk, and then delivering test results, monitoring individual risk, and monitoring UI campus area risk. These 2, the monitoring individual risk and campus area risk, we are developing an application that should be used by all the members of the Universitas of Indonesia, so that every day everybody should update their risk, and then they can understand, they can learn by themselves the risk of their themselves, and also the risk of the area, so that they can avoid if the area is not in a good situation. And then the second thing that is important is the multidisciplinary teamwork. This is very important. And then this is the definition. If we work together for the sake of the patient, for the sake of the communities, and we are having different expertise, then professional collaboration is there. So in the professional collaboration, it's very important that we have very strong leadership, very collaborative leadership, and then very effective communication among different professions. And then we have a very clear role each other, and then we focus on servicing the community it means that the community within the campus. And then if we have conflict, then we focus on conflict resolution. Then we have a team functioning. This is the interprofessional collaboration that we apply to prepare our campus to enter a new normal life. Maybe next semester or maybe next year. It depends on the decision of our government. So I think this is all I want to share with you. So thank you so much for your attention. So I return back to Mr. Chairman. Thank you so much.
Thank you very much, Augustine. Thank you very much for your presentation, for your definition of health, and telling us what the normal life, the new normal life should be. And also congratulations for the action you are taking, specifically for the monitoring the risk. And I would like to go deep in this probably later on. Now, thanking you again, I will move again with asking you again to stay in time. I will go to Hungary now, and Dr. Laszlo Gaermati. I hope I said it more correct, more or less, National Coordinator of Green Matrix in Hungary. Please, I give you the stage. Are you here with us, Laszlo?
Hello, everyone. Greetings from Hungary.
Hi.
Do you hear me?
Thank
Loud
you.
and clear?
10 minutes.
Oh, okay, lovely. So first of all, good to be here with you. With my colleague, Dr. Mátyás Dénes is participating with me in this webinar. First of all, he's gonna share our screen and he's gonna talk about the pandemic and the teaching collaboration and adoption in Hungary. And after all, I'm gonna talk you a few words about the sustainability achievements which we could achieve in the few months. So there's gonna be a two-parted presentation, and right now I'm gonna give the word to Dénes.
Thank you very much, and thank you for the possibility to be here. And please accept also the greetings from our rector, Dr. László Robo, and our Director General for Strategy, Ildikó Csóka. Unfortunately, unexpected engagements always occur, so now we are going to make this presentation about the effects and impacts of COVID-19 on our operation. And I hope you see our presentation. Is it shared?
Yes, we see the presentation.
Okay.
And yes, you can continue, and please keep an eye on the time. Thank you very much.
We will. We go to the next. Okay, so just to give you an idea about where we operate, where Hungary is, if you are not perfectly aware of it, in the middle of Europe, in East Central Europe, and Szeged is in the southern Great Plain region in Hungary. And we have certain ranking results. We are the greenest university in Hungary, and we have a certain tradition with origins going back to the 16th century, but operating in Szeged in almost 100 years. And we are a knowledge center in Hungary, in line with the governmental documents and strategies, like the smart specialization strategy. University of Szeged is a research university with a with a strong international community and broad range of scientific fields. Maybe veterinary science is the only thing that is missing from the spectrum. Here are some international reputation remarks about the ranking results in sustainability as well, like the green metric rankings, but also in the impact rankings of Times Higher Education and certain other sustainability rankings. We have nice ranks. As for the operation of the university, its operation is built on 4 pillars, like education, research, third mission, that is with the contacts and the operation together, and 4, the environment, the wider and the closer environment as well. And healthcare is also part of our operation as a clinical health center works within the University of Szeged. As for the impacts of the COVID-19 pandemic, the beginning is still before March 11th, But basically, March 11th is declared by the Hungarian government, and the aims of staying home and avoiding physical contacts is getting even stronger than before. But we have already had a coronavirus operative committee established at the university from January, when news were still arriving about the pandemic. And this committee was formed to address the situation in a comprehensive way from various aspects, like medical, legal, administrative, technical, IT aspects, and all those aspects. There was from central units and from central communication, information letters, circulars were issued to continuously inform university citizens about all measures and information about the pandemic and operation. And there is also a section on the university website providing information about the situation. Impacts were sensible and are sensible on many areas, like work and employment. The aim of the university was to maintain its quality functioning, and of course there was a transition to remote work as much as possible, quite successfully, so to say, and IT background was developed to have sufficient background for remote work, for home office, for individuals. For teleconference infrastructure was developed to have online meetings and online conferences, and to be able to use the various programs and applications to have these conferences. The Senate had online sessions, the faculties had online sessions, so everything went basically online as much as possible. The highest priority was, as for work and employment, to maintain all employment relations and positions and salaries. And in certain areas, of course, work activities were also rearranged a little bit, which means that maybe different emphasis was given to laboratory work or literature review, publication activity, maybe in certain cases publication activity, and that kind of activity was more emphasized due to the home office aims that we had. Then, as for education, before COVID-19, the university was already quite prepared to change to or to have an online education system introduced, thanks to online education developments and online learning materials and methodologies and similar activities that we had. Then after or during the pandemic, we had to change quite fast to online, and 21,000 students were to acquire their course material and are to acquire their course material online in over 15,000 courses. So it was quite a big issue to change to online education, but it happened successfully. An operative committee on online education was formed. The spring break, which we were to have in April, was moved to March to have like 1.5 weeks to work on the transition to online learning, and the switch to online education and learning system happened then on 23rd of March after the spring break moved to March from April. And online communication, online information scenes, chatbot, and similar tools were and are used to perform everything as earlier. Faculties, departments, and institutes had online education action plans, and the library also switched to function online, electronic services, and freely available e-resources, maybe in a higher volume than before. There are also 3 institutions of the University of Public Education which went online. And thanks to all these changes, the studies continued just as scheduled also during the pandemic. Some further resources that we had were the Coursera online education platform in which we participate, and these courses there could and can complement STE curricula, And we are in a European University Alliance as well, in UGLO, where online courses and trainings or virtual mobility could be useful for educational purposes. Then I'm trying to move to the next slide. Impacts on research. Basically, research activities were conducted uninterruptedly, and there are more than 30 research projects concerning COVID-19 in which the university participates, and these focus on prevention, diagnosis, the treatment of mild cases and the treatment of severe cases, rehabilitation, and many various researches are joint researches with Biological Research Center, or even the Hungarian European Clinical Research Infrastructure Network. So there is a big research activity focusing on the COVID-19. Impacts on healthcare, of course, were felt as well. As I mentioned, we have Albert Szent-Györgyi Healthcare Center. There is this healthcare center that operates within the university. The goal was to continue to provide patient care both for infectious and non-infectious patients, of course, with a focus on emergency healthcare treatment to minimize contacts between doctors and patients. And so all this happened in the Albert Szent-Györgyi Health Center. There was also a Center for Epidemics, or epidemic hospital opened with beds for patients suspected or diagnosed with upper respiratory infections, with intensive beds, with artificial respiration apparatus. So in terms of healthcare, we were also prepared well enough. Then an emergency unit was also opened in the laser center, which can be found here in Szeged, the Eli Alps, with more than 100 beds. And the university also participated in the nationwide screening in which the four medical universities of Hungary participated to test a representative sample of about 17,000 people in Hungary. The Semmelweis University, University of Debrecen, University of Szeged, and University of Pécs are these four medical universities in Hungary, and the University of Szeged collected 16.4% of the total national samples, and even now further testing is in progress. So we participated in testing as well. As for the future possibilities or the situation beyond the COVID-19 pandemic crisis, we will see, but there is a possibility of increased use of virtual staff meetings, enhanced online library use, new tools for communication and collaboration. We could experience now enhanced digital capacity, which can be used to new ways of teaching. As for likes and the things that students like are, for example, the schedule, flexible or not, but anyway, that they had, the active communication online that they had with instructors and they have with instructors now during the exam period as well. The various study materials they also like, and the video and similar homeworks as well. And some further opportunities we also mentioned, like e-methodologies or open book examinations maybe in the future. So basically this is in a nutshell the impacts that we had, and I would give a few words to my colleague László to say 2 words about sustainability issues during this time.
Thank you very much. Just to be real quick, there was a few positive impact of the pandemic situation in the field of sustainability in the University of Szeged. First of all, in the last months, we had a successful cooperation with the Ministry of the Innovation and Technology, and with this cooperation, we could obtain 5 electric cars at the University of Szeged to substitute the most polluting old diesel cars in the city. So with this innovation, we will be able to contribute to the cleaner air of the city of Szeged, and with this innovation, we will be able to decrease 16,000 metric tons of the carbon emission of the University of Szeged. And of course, with the pandemic situation, the electricity usage of the buildings of the universities dropped hugely. I would say around 50 or 60% in total, and there will be a huge opportunity and challenge that how can we be able to obtain this energy saving situation after the pandemic situation. This is a challenge and an opportunity as well in the near future. And thank you very much for your interest.
Thank you.
Thank you very much. Thank you very much for your presentation and also for your focus on, on sustainability. We'll have some questions, but I keep it for the end. So we will have all the colleagues presenting their contribution. And thanking you again, I will move to Chile now with Dr. Dario Liberona from the Universidad Técnica Federico Santa Maria del Chile. And Dario, are you there? We see your screen. I can't hear you, Dario.
I'm right here. Can you hear me well now?
Okay, now I hear you. Thank you very much for your contribution, 10 minutes. And thank you again, please.
Please let me know when I'm close to the time, all right?
Yeah, I will switch on my video. When you see my face, then we are close to the end.
All right.
Thank you. I won't interrupt you, please.
Thank you. Well, good morning, everybody. It's very early here. It's it's 8:50 a.m. We're in a different time zone, very far away. And basically, I have the experience of being I work in Chile, but I'm a visiting professor in Finland, so I could see both of those processes. So I wanted to give you some insights of parallels of both of them. I'm currently working. I'm back in Chile because of COVID, but I'm teaching at Seinäjoki University of Applied Science in Finland, which is a applied science university with around 5,000 students, and also teaching online at Santa Maria University in Chile with 20,000 students on 5 campuses. So it's very different sceneries in terms of different climate zone changes, different policies, different students amounts, and different cities. Santa Maria University is a very urban university, probably 5 campuses and around 10 million people in their cities. Seinäjoki University is a small university with 60,000 inhabitants in the city. So basically, we've been forced to these big changes and this major disruption in education because of COVID and in general all our lives. So the response to COVID, it's in my view, it's related to 4 major aspects. Is the health issues that we have heard a lot mentioned in these presentations, and there is the learning issue, which is our main topic today. How can we sustain the learning process during this pandemic situation? There is also the mental health or the quality of life that some of our speakers have mentioned, and then you have all the financial issues that I'm not going to be referring today, but it's a very important part of sustainability of universities, how we keep our finances well, and there is a big impact in some countries. It depends on the country, and it depends on the policies of different governments and how does impact us. So basically, in terms of health and what happened, and our situation was very similar to the ones that have been exposed so far. We started with social distancing sanitizers in February. Then we went to online mode in March. The situation with exchange students and mobility all over the world has been affected. In the case of Seinäjoki University, there is 500 exchange students around. and 39% of them returned into their home countries. So started their teaching there, but a lot of them decided to stay at St. Ayaki. Then we started with a lot of campus restrictions and limited access, and finally in April we closed the campus, and it has been partially reopened during May, and now we're about to go to the summer break. So in the case of Chile, the classes start in March there. So all the virtual selection of students have to be done and during February on March. So that started with the process of remote and social distances. So the majority of exchange students return, and we have like 700 exchange students. We went to class suspensions, campus restrictions, and the campus was closed. And like in Ecuador, there were also some activities related to helping society, to creating at our Fab Lab, there's facial masks, so we distributed in hospitals. We also developed models of ventilator machines, because we in Chile we have a lack of that. And there were during all this process there were temperature access controls, trying to spot who might be sick with the disease or with symptoms. So the responses were very similar in other countries. And what has had, what's next in terms of health, there's gonna, in the case of Finland, the plan is to go back in September to presence class, but there will not be exchange student accepted for 2020. And our students were recommended not to go on exchange programs. In the case of St. Ayaki University, go abroad as an exchange student is mandatory for graduation. So this year, their recommendations not to do so, it will not done. So we will basically devote ourselves to in presence mode to local students. So there's a lot of social distance policies. We can have less students per rooms. There's going to be a special cleaning like we saw in Turkey or and other countries on the presentations. The use of mask, it's still debating if it will be mandatory or optional. And there's going to be a lot of changes in the lunch cafeteria, water corridors, et cetera, for the next semester, which is the physical part of the health. And in the case of Chile, the country it's in a lockdown mode in major cities, and the plan as of now is to reopen the campus on August for the second semester. There's not going to be exchange students, and there's going to be implementation of TWIS, a quick test COVID or stuff like that at the campus, and also a lot of social distancing plans, which is some of the measures that a lot of you have mentioned. And if we think of the university policies in terms of health, and we're restricted a lot by the country or government policies. Here we see the cases, contagious cases in comparison between Chile and Finland. You can see that Finland, it's planning on reopening, and actually has done the last few weeks. Schools were open for children. We didn't return at the university to classes, but the campus was open. You could go there with some specific measures. But in the case of Chile, we're really increasing. If you see the cases of COVID in the world, we're in the top 20 countries with more casualties. So that's very sad. And some of the countries that have presented here are at least 5 of them are on this list of very affected countries: Italy, Turkey, Ecuador, Chile, and others. So basically that's what's happening. So every measure that the university takes will be very much related to the policies of the government. This is the death cases, Chile versus Finland, which are more similar. In the case of Chile and Finland, the first case was on the same exact day, And if you ponderate this by the inhabitants of the countries, you could see that we were not very different, but Finland got it quickly and then has stopped the curve. But in Chile, we're really increasing. So there is very little chance that the campus will be open in August, to be honest, but we haven't taken the decision of suspending the semester and continue with the online mode. In terms of learning, well, class suspensions were matched, all programs were moved to online mode. There is a difference between in Finland and Chile in terms of the distance learning versus online learning. As you're aware, when we talk about distant learning, it's basically the students do most of themselves, of the work themselves. They don't have these online classes. And a lot of teachers in Finland choose to go to that mode. They didn't feel really prepared, or they were not happy with the online classes mode. In the case of Chile, all of the teachers went into online learning on the same classes, the same schedule. So it basically we replicated or try to replicate the physical classroom on the virtual mode. So in Finland, in Seinäjoki University, there was a very useful pedagogical team that we created. So they were teaching, helping everybody to use the tools. So that went very smoothly. There was a lot of jokes about the big blue button of the Moodle presence online platform and technology to use. And then in terms of technical tools, Microsoft Teams was the most used Teams. So there was a lot of aims to try to keep contact between teachers and professors. So there were like coffee every twice a week. There were these groups of having virtual meetings, like gathering together and commenting and sharing with each other. So it was very nicely replicated for the teachers in that mode. In the case of Chile, the platform that was used, it was not Microsoft Teams, it was Zoom platform, and also to prevail to continue with the online teaching at the same times and hours, and the teachers are required to tape all the classes so they're available for students that are not there. There was a lot of basic online training, but in the case of the university, different departments, let's say business, engineering, architecture, they have different approaches to the teaching, so they took different tools, but mostly they use Zoom platform, and the Moodle was used more. And they develop a call center for teacher support. So teachers that feel that they need any help or on spot, they could call this training center, and they're available all during the week. And in the case of Chile, we have, like Ecuador, we have a lot of issues with the internet connections or computers availability. So we lend computers to students. We give scholarships to pay for the internet plans and connectivity to ensure that they have access to the technology and they improve it. So there was a lot of ways to help students how to be more connected or to have access to more technology for them. In the case of Finland, what it's planned for the second semester or for the beginning of next year's of our next academic term, since September, there is going to be, as you know, presence classes, because we are going to open the campus, but there's going to be offer parallel classes online for students that could not come. And here's all the exchange students issue. So we don't know if they will be able to do and do the career at the university. So we're offering them to start online, and then they can come if they could get visa and the situation is resolved. But if not, we're going to return their tuition fees, so they have a chance of moving or doing something else, or taking a different decision in terms of distance or online learning. There's been some Microsoft equipment and some technology implemented. Like we were mentioning here before, putting cameras, adapting the classrooms to have less students, and to do a lot of online streaming transmission of the classes. So that's the plan in terms of Finland. In the case of Chile, the plan is to go back to normal classes in August, September, and if not, continue it until December with the classes. So in this case, there was a lot of support for teachers that really did not wanted to do online classes. They've been, if you're aware, the Moodle platforms has been in place for many years, but a lot of teachers have refused to use them for many years. So we have this case mostly with physics and math teachers. We have a lot of that for our engineering school. So we bought them Wacom tablets so they could write on the screens, and they have tools that they could teach their way. So that was, and it worked very nicely with some of them, and with this online sort of training and this call center where they can call and have help all the time has helped a lot. And there is a lot of, and there is some debating now if we could go into having complete career majors online. And we don't provide that at the universities yet, but that's one of the issues. Could we do that for the long term? So that's on the table, but we haven't really taken a decision with that. So basically, in order to continue that, implemented technology is fundamental for for our universities. In our case, for the classes, different universities, I mean, Zoom was taken by Santa Maria University, and Microsoft Teams was the major tool at, say, in Yoke University, but you have other tools that you can use, OneNote, Google Classroom. And the main platforms, of course, were Moodle and Blackboard. And what happened now during this COVID, it's that the increase or the final use of this platform really skyrocketed, and everybody's using it now. So we were trying to use them for a decade, and now we have make it work in 6 months. So it is working, and there's a lot of other tools and technologies that you can use, and they're available. So every teacher, it's taking the ones that they want to do. We don't have a program yet to implement all of these, or to train them, or to make it equal for every teacher. But there is so many tools that have been developed in order to enhance the learning experience, because the most important part here is that we don't try to copy the way we use classes with the new technology, but rather adapt our classes, our teaching, to all the available tools. So that's a challenge that has not been addressed yet, but it's on the table again. So one important thing is like, okay, we did all this, but what happened? What do the students think? So we make a survey. This survey was only done in Finland. It was not done in Chile. We haven't finished the process, but what happened with the motivation? The students declare that they were 44% felt less motivated by online classes on this new mode. But unbelievably, there is a group of students, 22% of them, that say that they feel more motivated and they think this is better for them. In terms of stress, 51% of the students declare that they were stressed by all this situation and all these changes and the COVID situation in general. So there is a lot of stress in the universities. In terms of the process of switching to distant learning, the majority of students say that it was very well done. And in the case of Finland, it was good at excellent, almost 72%. And in the quality of teaching, with something that it's on the air, everybody says, okay, we're lower in the quality. Even there is so many surveys and study and proving or showing that the online learning, it's almost as effective, or is as effective, and in some cases even better than regular learning. We don't want to believe that. And in the case of students, some people, it's almost half and half. Half thinks that it's the same, and half of them think that it has decreased the level of that. In the terms of technology was very well implemented. The study progress, most of them declared that it was reduced. It was like some of them that improved, but a lot of them thought that it was reduced the learning. And two other very important aspects for university is communications with the students. Keep them informed. It's a very important task, and it's mandatory if you want to have a good process. I mean, keep them informed of everything what's happened in advance. And the main communications channel was not social networks. It was really what they like is official mails from university. They even though they're supposed to be social students and being social networks, they write it formal communications all the time, and that worked very nicely in Seinäjoki. And then the other aspect is this study guidance. I mean, there is a lot of different situations that arise from here. You have, I remember one student that his wife was a nurse volunteer in Africa. She couldn't return. They have 5 children. He has to take care of the 5 children. So this also situation was very complicated. So if you have guidance and the teachers are close while you're not coming to class, if you give them feedback, what happened, these will help them out a lot, and they will really appreciate it in terms of their studying and learning process. So the process in Seinäjoki was very successful. In Santa Maria University, we're not sure. We are undergoing. The semester is going to finish in July, by the end of July, beginning of August. And there is a lot of challenges for the next stage. How to stay motivated for the students. That's something that there is a lot of tools. I'm not going to get into that, but it's very important that we keep the students motivated, and communications help. There is a lot of ways to help on that. How to evaluate the learning was also mentioned. Are they really learning? How much are they learning? We're not so sure about that. We see this screen and we see all the people here, but we don't see what's happening behind the screen. And it might well be this. I mean, they're not paying attention to doing something else. They even put their pictures on, but they're not there. So there is some issues about that, but I'm sure that there is a lot of ways of how to solve these issues, and we should help teachers to suggest them ways or ideas how could they do it better, because they have to change. How to keep engaging classes so that they're not bored and they're happy. So there is a lot of tools that are available, gamification, know your audience, and there is many ways, but it's important that we don't try to copy or presence classes into digital. I mean, we have a lot of technology, so we could do a lot better. So what's next? Cambridge universities already have told everybody, announced that his whole next year it's going to be online. So they have taken that decision. In the case of Seinäjoki University, we will go back to presence. In the case of Santa Maria University, that's the intention too. But there is something that we have to keep in mind. In this uncertain environment, it's super important that we assure that we're going to learn and continue teaching. So there's a lot of other issues, like thinking of having new full online programs of different careers or teaching different things. The reduced mobility is going to be for a while or forever. The difference between distance learning is that the students do everything by themselves, or to have online learning or blending, there is some issues, and universities will have to take decisions. And there's not one solution for everybody, so it's better to have a multiple matrix with different options for students. We need more technology adoption, bandwidth, etc. We have to improve our communications, and there is a cybersecurity issue that nobody has mentioned here. But now, since we're going online, security is going to play a very important role, and universities, or most of universities, are not really prepared for this. We have to embrace innovation, more collaboration, and take what's the best and what could be permanent changes of these. I believe that there's going to be permanent changes. So in this uncertain environment, learning should continue. Online learning is a big opportunity. We could do it anytime. We could do it anywhere. We can do it anyhow. We have to find a way. And anyway, no matter what happens, we should teach. I put this picture with Dalai Lama because I ran into his conference in Facebook. I thought it was unbelievable how he has embraced technology and is doing it. So my final words: online learning is not the next big thing. It's the now big thing. So please embrace it. Thank you very much.
Thank you very much, Dario. It was very inspiring, a lot of suggestions. Thank you also for sharing, well, first of all, for this parallel presentation between Finland and Chile, very useful. I also have a survey of a student, and I will also add, thank you for touching the point of the motivation. That is also, you are anticipating the questions that it will come later. So thank you again. I will move now because time is getting short before the discussion to the sixth speaker from Latvia, Juris, I believe, is the national coordinator of Green Metric for the university in Latvia. Yuri, are you there?
Yes.
Yes. Hi, now
yes.
I see you. I can hear you. Please, 10 minutes. Thank you very much.
Yes, thank you. I hope you can see the presentation and
yes, now we see it. Thank you, and please keep the time. Thank you very much, Yuri.
Yes, thank you very much. I will try to be brief. So my name is Yuri Silians, and I am a director for quality management and sustainability at Riga Technical University. I will try to keep my time, and because we're on a tight schedule. My presentation is going to be more practical on or case based on what have we done during this pandemic and how we have reacted to the situation. So first of all, Latvia is located in northern part of Europe, and I don't have the data in my presentation, but before we start, I think it's important to understand that Latvia was not particularly hard hit by the coronavirus. We have had, I don't know, maybe 1,000 cases in total, people who have gotten sick, most of whom it was only in very light form, and only maybe up to 10 death cases, mostly people of age. So situation here hasn't been very hard, so therefore maybe also the restrictions and everything that follows that comparing to other countries haven't been that severe. So the Riga Technical University is the oldest technical university in the Baltic states. And if you're talking about some data for you to get an idea, so we have around 15,000 students. We have all three education levels, around 600 PhD students, and more than 140,000 alumni, and around 12% are international students. And if you're talking about the biggest impact, of course, the biggest impact for us has been the drop of applications for the next year for international students. Because of travel restrictions, because of other concerns, we already see at least 20–30% drop on applications if we compare it to the previous time period this year. But we expect that the total numbers could be even less who actually go to university. So if we talk about study process, I think the most important thing that we should mention is that due to the situation, and we are mainly engineering university, so we don't have only lectures, but also we have laboratory and practical works on campus that we usually provide. So therefore, when the crisis started, we extended our semester till 14th of August, and we have delayed the start of the next semester that is, we are going to start on 14th of September to kind of complete the intake process. So the semesters have been shifted, and when the situation became more serious, we of course closed our campus, and no laboratory or practical works were not allowed. Therefore, only lectures happen in distance system. And then when the situation restrictions came out a little bit, that was in second part of April and in May, then we already started in very small groups to allow students to go and complete their laboratory work. So we had a kind of combined system. If you're talking about student dormitories, because this was of course a very high risk area for students who live there. If one could get ill, then there could be a lot of problems inside the student living space. So we did not close them, but we had very severe precaution measures. So for example, temperature taking for every student who comes in. We also, and staff and employee, also we have masks, and we have divided students so that they wouldn't be as much in one room as they were before. where it was possible. If you're talking about e-learning experience, then of course we have we had already our own e-learning platform, and which was greatly supplemented with new material. And I would say this was kind of, in first weeks, it was kind of shock for our academic staff to go from being usual learning to the new normal, as we say. And if, for example, we have few projects where we have to make kind of online lecture materials, and academic staff was not so interested to doing that in the beginning of the year. Then after this pandemic started, we saw a great number of increase of our academic staff members who wanted to for us to film and help with their lectures to be more online to finish this semester. And so in our already existing e-technology platform, we kind of have general information, we have technical support, we have pedagogical assistance, and we have experience stories which we have put in, and we also have organized remote examinations, and already first PhD defenses have happened completely online. Also, next thing that I think is quite important, that we together with different providers, we're not talking about Zoom or Microsoft Teams, who have become now a regular part of our study process, but we acquired different licenses from Coursera and edX to supplement our study process, so it would be with more digital materials, as initially our lectures, of course, were not all filmed, and the digital level was not that sophisticated. On the practical side, I think it's important for us to mention, because we as a technology or engineering university, our goal and mission is not only to teach students, but also to provide help to society and to the government regarding in this crisis situation. So we created a new research platform for specific purpose to help with different ideas of COVID-19. So here we have researchers and could submit their ideas, where at least where you have to get quick practical solutions out that could be helpful in the situation. So the rule was, after 2 months there has to be something working, that something can be already put to market or put to use. Second, we used our supercomputers to help with the different studies of data that also was required, where our government asked some assistance, and we also teamed up with other materials and research centers to analyze large data, especially about the virus and more concrete modifications or mutations that we have here locally in Latvia for the virus, to better understand our local kind of changes or the virus itself. Then our researchers quickly reacted and made a study to understand whether the coronavirus can be spotted through the sewage systems or wastewater, and this gives an idea if even official data about illness is not there because of limited number of tests that has been taken. Then through wastewater you can see more clear picture of how large is the impact of coronavirus situation, because you can through sewage systems it can be traced back to the city and see the intensity of it. Next, we did a crisis lab. In crisis lab, 230 students from 15 different universities came together to create different solutions. And for example, this was in early stages of the crisis, one thing that came out of this crisis lab was we developed new masks when it was a deficit product, and we put it relicense to a company. For university did not take any profit at all, and at least 400,000 pieces were ordered from Latvian government in the midst of the crisis. Of course, also different prototypes that came out of lung fans and others that could be provided to hospitals, and there are already first manufactured pieces that have been given to our local hospitals. And of course, our students also kind of developed a new bracelet to help the infected with the virus that takes your pulse, body temperature. You can see your amount of oxygen and things like other things to help those who are infected follow their health situation on a regular basis. And also with this bracelet, you can get the proximity of the person with the accuracy of 2.5 meters. It's not in the presentation, and also our students developed app for tracing the coronavirus that we've manufactured. We developed together with Latvian IT companies. In short, that is, I think, how we have tackled with the crisis and how we have tried to help with some practical ideas with research and product development in the situation. And I think the impact has been, at least our government is has been very happy with us helping them out, especially in time of need. The most challenging part, of course, was the rapid deployment of products. But I think we kind of, our young people were very enthusiastic, and they made it happen. So in short, that's it from my side. Thank you very much.
Thank you very much, Juris. Thank you very much for presentation. Thank you for your focus on research and innovation, which was very interesting. And thank you also for staying in the time. And I will move now to the last three speakers before we turn into discussion and questions. And I will move immediately to Saudi Arabia. We have Dr. Habib. Dr. Habib, are you there?
Hello.
Hello.
Good afternoon, everybody.
Thank you.
Thank you very much.
And now we can see you.
For you.
Thank you.
Thank you very much again.
And you have 10 minutes, please.
Thank you very much again, Micro. Just want to connect my screen. It seems that it's not working properly. Just
no, it's not working now.
Okay. Okay. I'll try to.
We don't see it. You can try to share it.
Okay. I think yes.
Yeah.
It shows that options or something like that. Okay. Well.
Okay, we see it now.
Good afternoon, everybody. Again, thank you very much for this wonderful. Thank you again for this wonderful seminar. I was really happy to hear how other universities and colleagues are working on for education and learning in these times. I hope everybody's safe and so on. So I will concentrate from my point of view at King Abdulaziz University from a different perspective, which is what we have done for research and also for community service from the point of view of King Abdulaziz University. And because usually here in our kingdom, the learning, teaching, and processes are given from the Ministry of Higher Education. So also I will give this perspective from their side. So King Abdulaziz University, one of the oldest universities, public universities in Saudi Arabia. It's a public university, huge in terms of space and area, almost like 7 million square meters, and divided into several branches. And we have almost like 34 colleges, 4 excellence research centers, and 5 institutes and scientific research centers also. So we are research-focused university. We have almost like 6,000 academics, 160,000 students, who are divided between 110,000 distance learning students and 50,000 regular students, which means that King Abdulaziz University already has experience in teaching online learning and also distance learning since almost like 10 years, 15 years. So we haven't faced that much difficulties from changing from one side to another now with our students, or with the resources at the university or the materials that we are using at the university. It's a requirement for all academics who work at the university that they have and they should participate in online and distance learning since they joined the university. So this is one of the points which was we have handled like wonderful, and almost all our academics are experienced in this area. So what we have done, well, before that, I would like just to share some of KU reputation. We are ranked almost like first in the MENA region in almost all rankings, and in the world we are also within the top best universities around the world in QS, Shanghai, Green Metric, and also THE Impact Ranking, and the new one for sustainability. So from the perspective of the Minister of Higher Education, with all education institutions in Saudi Arabia now close to distance learning, and KU is one of these universities that already has this experience. But even though we have found consistent challenges which was affecting the education and the let's say the density of the number of students who are trying to access the university webpage. So, some of these measures that the government and the Ministry of Higher Education take was a little bit different from the perspective of how to teach, and so mostly it was decisions related to giving students the option to withdraw, even though that they have all of them to attend these classes online and to show that they have been attending and doing their homeworks and examinations at the end. But also the Ministry of Higher Education gave them the option that at the end of the courses, they have the right to decide if they want to postpone the semesters or they want to get the results directly. So in case that the purpose of behind that such decision was to ensure that these students withdrawing or postponing semesters do not have their grade points average affected by coronavirus, and they have the whole right to decide on this. Decisions from the Ministry of Higher Education also include higher education facilities being requested to grade students on the current average marks or on the previous grade years. So in case that a student working, okay. In case for our students who are studying abroad, which we have a huge number of these students also, these students usually have a scholarship from the ministry, and as you know, almost all Europe, USA, where our students are located, have been infected like highly and requested to return back to the country. So our challenge was how to reallocate them within our systems and divide them between the universities. In Abdulaziz University, we have about almost like 15,000 students studying scholarships in between Europe and America, while the whole kingdom has almost like 150,000 students. So it's a big and a huge number of that we are talking about. We are still trying to find ways in how we have to deal with this huge number that we will have to work with. Other issue that that we are facing within the whole country was the data protection, privacy, and cybercrime. Yes, we have been talking about that since long time. We have been dealing with this long time, but we did not really live this situation to see how this will affect, how this is really built and done, and how it is a part of our life. So for the data collection, distance learning has forced universities to use new technology and systems in order to ensure continuity of education. We have our own system within Blackboard, which we have been using. But now with using like video calls, teleconferences applications like Zoom and Microsoft Teams, which are like a huge number of people also are using them over all the world at the same time, and they are overlapping. And many times we have found that many in Teams you can invite many students who are not within your classroom. In Zooms, if you provide the link for some or set of groups of students, those can also invite their friends and so on. So there was a big and huge gap there that we have been facing, and mostly because we have been not obliged, I want to say, but invited to use these other tools because of the pressure that the Blackboard and tool we have been using has. So these online tools are used by students to deliver assignments, also to engage in activities and communicate with other students. So the behavior and affecting the teaching and how the academic can monitor his students was completely organized and prepared through the university, because we have done a huge number of seminars, workshops, training the students how to use this, and also at the same time the academics how to deal with this. But the data protection and law privacy was still like a gap for us. But now taking off the data collection and the privacy of the data and the cybersecurity and cyber crimes, like some of students sharing information about their colleagues or trying to not making these classrooms go correctly, because as I have said before, that some of these students can share the links with their colleagues, and these colleagues enter the classroom and start like disturbing and doing things. Also at the same time, and with teams that some of these students who are not related to the university can join it, and because the system gives this permission, also affected too much, as we have seen at least in our region and what we had. Also, as you may know, that our campuses, regular campuses, are divided between female, separated from the male campuses, and this also, because we had to share the videos and so on, also was a new experience for us. But at least it was a new experience that shows that we are able now to merge and mix these two campuses in one, according to the Vision 2030 of the Kingdom, which is wonderful and was a good experience for us. Last in this point was the social media and defamation of the data. Even though the government has some laws that follow up this type of information. So it will follow up all the crime list and any person who publish secrets about a person private or a family life, or who insults a third party and so on. But again, it was a little bit difficult to find these people. It seems that some of these people are experts in terms of using VPNs and having these portals till they reach the these classrooms that we have. While for the employment issue, yes, we have been facing a little bit of difficulties in terms of needs to reduce staff costs. But with that, what we have done is, instead of making headcount reductions at the university, what we have done is borrowing our staff. Like because we have a huge experience, all our academics are experienced in using online tools. All our academics are prepared to teach, have their own materials, resources, and so on. And all our programs are accredited. What we have tried to do is to share our programs with other universities, mostly those private small universities in the Kingdom and in the region, And but by this, our staff was able to share with them their experience and even teach at this university online courses because their academics were not prepared and they did not have enough time to prepare them correctly at the beginning. So this was helping us too much so that our academics stay at the university, did not feel at any moment that they were be listed in the reduced staff list and so on. So this is one of the points that we believe that was a wonderful experience and at least expertise for the university academics. Okay, so as I've said before, our university is a huge university, and we have almost 160,000 students. And the Blackboard and the system that we have is really huge and intense, and we can really made all this type of teaching. What we have done through our system is create these programs, make everything public for everybody, even though they are not registered at our university. They can access the tutorials, the programs, the courses, the videos also to see how we are teaching, even though they can try to do the e-exams that we have, even though they are not registered. It's a different list that we are collecting data about how many students are really likely with our e-exams, the way that we are preparing them. And the student associations, we created this new part of this system. For our academics also, we have the same similar system, which is under the also Deanship of E-Learning and Distance Education at the university. And all of these teaching and learning processes and techniques, they can use it. And this system allows them to create a new list of students according to the new university that they are borrowed to right now or they are dealing with, and to provide them with help and access. Even though that our system is almost like or uniquely depending on Blackboard, but we made use of Zoom and also MS Teams, because these other universities, mostly these small and private universities, wanted their own not system, but their own cloud data where they can collect the information and use it. So we adapted our academics to these also new tools. Other new things also that we have done at the university, again, we have 50,000 students in the kingdom. We have about, between these 50,000, about 5 to 7% of our students who are low income students, and we understand that at the university. So the university decided to provide all low-income students with a laptop so that they can be able to attend these online class rooms and this online teaching and learning process. So we provided 3,000 laptops for our students for free charge, and they don't have the need to return it back once everything is resolved. And I do believe that this is one of the wonderful actions that the university has done. And even though the university will take this laptop by itself through companies like and send it to these students wherever they are in the kingdom. From the other side, the university, as I said at the beginning, we are really focused research university. So we have done a little bit for this pandemic, like KU laboratories are developing new research techniques or finding vaccines. And we have already published more than 250 publications at the university related to the corona or COVID-19. KU pooled resources allowing for vital information and breakthroughs to be shared through its Deanship of Library Affairs portal. So everything we have at the university, we are showing it. And I will use this. Nico and Bert here also are from IRIG. We proposed IRIG to build a portal where we can share all the information that we have here in the university, and also to share our experience with all the institutions at IRIG, so that we can attract as much more people as we can and help each other and share our experience how we have done this in the region. because too many universities, is really a huge number of universities that they don't have that much facilities to produce this. And by this, we found that more than 32 universities access the university portal of the Deanship of Library Affairs and was downloading all the resources with the students and academics, which was really good for us. While KU Hospital is one of the best hospitals in the Middle East area, according to the ranking list of clinical studies and so on, they are doing a huge also job in terms of donating spaces, equipment, and treatment for patients. And we have like learned from past epidemics like the corona in 2014 and all this experience of how we have done it, and so that we can deal with the test of the for our alumni, for our students, and for our academics was for free for everybody to come to the hospital or to reach them from the hospital people and provide them with this service. Other points that we are really found that the university such as the King Abdulaziz University have been lent huge experience from this past epidemics, containment protocols and safety measures for healthcare workers and working to discover and develop treatments and vaccines that might slow or even stop the spread of the new coronavirus. In many cases, KU is also collaborating with the government at the same time and with the private and sector and non-profit one, as we do believe that this is a situation that we all have to be joined and providing this. KU also is using its expertise to engage faculty, students, and alumni and other entrepreneurs to motivated by this pandemic to identify problems that need to be resolved. We do understand that at the university, we are not like experts in everything, and we need to know what other problems we have been facing. We have almost like 42 research projects with a huge amount of funds, which are being like right now developed and implemented at the university to find solutions, help in stop this pandemic as much as we know and have knowledge of. These are some of the pictures of our academic staff, medical academic staff working on these projects. Again, KU is being a key source of accurate science-based information that inform policymakers and the public about everything from how to sanitize workspaces to the history of past pandemics, as I said before, and is providing local health guidance and information, not just for the university academics. We are reaching all the malls at in the city, in Jeddah city. We are reaching all people at their home, houses, homes, and like open spaces to share with them this guidance information. Try as much as we can to make them understand the current situation that we are living. KU open new programs, allowing students to register in higher number of credits so that some of medical students graduate early. It's like a parallel program that we have built and to get them ready and as quickly as possible to start working, mostly at the hospital of the university and to help the administration of Jeddah. Students associations also, we saw that they understand and they know how much this is important. And I will share with you later how they have developed and built some equipment at the university and make Jeddah self-independent from any type of masks. And we have provided more than, I'm not wrong, 1 million masks at the end. And this was last week statistics. And provide also hand sanitations and so on. So we understand this importance that we have, and the university hospital also facilitates increase the number of beds as much as they can with the space that we have. But yes, they have create a quick test for COVID-19, which provide you with results in almost like 8 hours, which was really necessary and important for us. Academics, students, and alumni of the university, all of them have been involved in all these processes that I have been, I'm saying you. And also at the end, offering ethical guidance that we saw that it's important, and the principles and approaches to help healthcare professionals make hard choices as the number of people needing care eclipses the healthcare system capacity to provide it. It's difficult decisions, but we thought also that we haven't lived this in that much huge, and it was important to have this information spread between the public and also the academics. We have done hundreds and hundreds of workshop seminars, not just to inform people of how they have to deal with this epidemic and so on, but also how to use technology, how to be safe right now through using computers or mobiles. And our students, as you can see, were there all the time to teach people how they have to deal and work. We have spread many envelopes, information for our academic students and the community. Also, we created some applications where our the hospital will contact anybody who has any problem in Jeddah, and they will send them any help they may need in terms of this epidemic.
Thank you.
Finally, the students of the university developed this mask and have been spreading them for the whole people of Jeddah. We are talking about 5 million people. So it was big and a challenge for the university, but our students show that they are capable to do it in such time. The only issue before finishing that, to show that also we had some real problems, is that we have some special needs students and academics, and we have faced some problems of how to adapt because our online learning courses were not adapted for special needs people. And so we faced that this problem, and it was really hard for us. We tried to send them like mobile teaching classes where some of the academics will go and find a place, the best place possible, in big caravans, and go there to the next to the home of the students. But we are talking about almost 6,000 students and academics who are facing these problems. So it was really hard to reach all of them. We tried to adapt some courses for them, but again, it was a big challenge for us, which we haven't. I do believe I'm completed correctly at that. Thank you very much.
Thank you very much, Habib. Thank you very much. Thank you also for your last point about students with special need. We will come back to this because it was also one of the questions. And thanking you again, I moved immediately to the last two speakers. Please bear the time in mind. And we will move now to Mexico, to Dr. Hector Perez Montesinos from the university's National Coordinator of Grimetric for the University in Mexico. Hector, are you here? Hector, I can hear you. I cannot hear you. I don't hear Hector. No. Hector?
Mirko,
I think I heard something.
The next speaker.
We go to the next speaker. So we jump to Birte from Denmark. Hi, Birte, how are you?
Hello, thank you. I'm fine. Thank you.
I hear you. I don't see you, but I hear you. Please, you have the floor. 10 minutes. Thank you very much. Nice to see you again.
Can you see me now?
I can hear you. I don't see you now. I see you now. Yes.
Okay.
And now you can share the screen if you have some slides or video if you want.
I will do that.
Thank you very much.
Just a moment.
Yeah.
I will share the screen. Share screen.
It's on the bottom. You see
I am.
Share screen button.
I am here. Thank you.
Okay, you start. Now we see it. Thank you very much. Please.
Thank you. I would like to ask the organizers if I am a host, because I have a small video, and to be able to hear it, I have to be a host. Okay,
Yeah,
thank you.
I think the organizer are taking care of that.
Yes, thank you.
Please go on.
Yes. Hello, everybody. Here from Denmark. I'm very glad to be invited. Thank you, Riri, for inviting me. Just to show where we are, I'll just show you. This is Denmark, and this is the part of Denmark where we are in the top of Denmark. I think I forgot to show this as a. Oh, what happened now? Okay. Is this a normal PowerPoint now at your screen?
We see your second screen, but we can see it. Yeah, we don't see your first screen. We see both of them, but it's okay. Go ahead.
Okay. Okay. Thank you. So just want to show you this picture from last time we were together here at Aalborg University, just to show you our relationship with Green Matrix as a coordinator for the Scandinavian countries. Okay, now we start. We are about 20,000 students at Aalborg University. A few part-time students and 850 PhD students, and a little bit more than 10% staff. We are 2,230 staff. The next thing I would like to start with is how we are ranked. Aalborg University is, we try to say that we are a sustainable university, and at the last ranking we were number 23 in the world in the impact ranking. In the Green Matrix ranking, we are proud to say that we are number 63 in the world. We are very strong in engineering, and if we look at the US News engineering ranking, we are the 4th best in the world and the best in Europe. Proud to be that, as we are such a small university. And now to the very best part of it, where we actually won the impact ranking at quality of education, where we are the best in the world. So I had to tell you a little bit about ranking, as we are here at a ranking institution. Very, very short about the COVID-19 situation here in Denmark. We are almost 6 million people, and until now 593 deaths. As far as I know, nobody has died just of COVID-19. They all had another serious illness when they died with COVID-19. When everything came about the green and the red curve that we have heard so much about in almost all countries, we start finding out how many inhalators we had, and we have about 2,000 inhalators. And this is the situation. We have never been able to use more than 150 inhalators, so we have never had a severe problem. I think we have helped other countries lending them some of our inhalators. So that was a situation about the illness and how it has affected us here in Denmark. so it was not so bad. What happened here at Aalborg University was that in the middle of February, the shared service made a COVID-19 task force where they decided what to do if the pandemic hit us in Denmark. And what we did was that our director, who is actually a former officer in the army, he made this task force with himself and the rector's office, two journalists, the campus service that takes care of all the buildings when they are opened and not, the human resources, and the section for health and safety, the study service, and the IT section. They simply made this COVID-19 task force to be able to act if the worst thing should happen, that we had to close down our university. And it happened. And now I will show you the time, very shortly show you the time. At the 26th of February, the first Dane was confirmed infected. Already at the 28th of February, we had the first mail from our rector who said, stay at home if you feel sick. And the 28th of February, there was the FAQ opened at our homepage, so we could see all questions and answers, whatever happened about COVID-19. Already at the 4th of March, we had there was a new email called info about coronavirus to send out to all the staff. And we made a new homepage about digital supported learning. The thing is that Aalborg University, we don't have any distance learning before. We have distance learning, but we don't have any distance learning program. So we had to act very fast to find out how to act. And I will come back to this distant learning group that we have now. So then the border closed at the 14th of March. We couldn't get in and out of our country. And the 17th of March, all public institutions closed, hairdressers and so on. And the doors was locked to the university. And also at the 17th of March, our Queen Margaret talked to the public for the first time in her, I think she is 80 years old time, except from New Year's night. And she really talked to us and said, now please stay at home and behave good. And that was a really important thing for everybody here in Denmark, that showed that this is a serious time. So shops outside malls and food shops inside malls still open, and the private sector outside and IT job was still open. So our country hasn't been closed down. What I would like to show you now is that my student will tell you in 3 minutes very shortly about how it was to be a student. And now I will turn on the video, so please listen to him for 3 minutes.
Okay, thank you.
Can you hear him?
No, I don't hear it. We can see it, but I don't hear the voice.
This should be because then they haven't made me a host, because I've just tested it. Well, if it doesn't work, I think I'll go to the next slide, because then I will not use 3 minutes of it.
I can see it, but I personally don't hear the voice. So the video is mute for me. And I believe it's a general thing. Very pity, but you can.
I will close him down then. I'm sorry. I tested it yesterday, and it should work, but it didn't.
Technology.
So don't.
Sorry.
Yes, let us not use time on that video then.
Okay.
Okay. then I'll go to the next slide. So the most important part of the university was the task force about informations at the university. And as I've told you, we had the Corona email sent out from the rector's office. We have the Corona homepage to tell all news about whatever happened. Also the good stories about the research we have, and the Corona FAQ, and then the most important thing, the Corona digital supported learning. We also had contingency plans, and we had contingency groups, and all the university was changed into contingency groups. So this is where you see the university with the board, the rector, and the pro-rector. This is all the deans, faculty of social science, humanities, and so on. Instead of that, they had the all their group was only to tackle the COVID-19 situation. So the university was changed into contingency plan, and they had to report into the contingency group, as I told you about first. So the first one, this is the homepage information about the coronavirus, where you could see everything, and this homepage actually existed before the university was locked down. And this is the coronavirus FAQ, where you could see everything in Danish and in English. So that the 10% English speaking students also could, and teachers, researchers also could to get all the information. Before this happened, we have a Center for Digital Supported Learning. We started that 2 years ago because we have found out that we was not so good at that, because we are not at so digital. Our learning is more showing up and working together in groups. But this Center for Digital Supported Learning was changed into um, digital supported learning in coronavirus. Everybody working there was asked to work all 7 days a week, all hours every day, and they have completed an enormous amount of tools to all the teachers to work with, and they could get answers at all the questions. And we already had bought everything. We had, except from Zoom, we had all the tools at the university for all teachers and students. So that was not the problem, but the problem was to help people to get ready to use it. So our Center for Digital Supported Learning, they have developed best practice support for the study environment, digital platforms, and they answer email and telephone all day. The very, very big problem at our university has been that our pedagogical platform is problem-based project learning. So all students at all semesters has to solve a problem, so that they learn through problem solving. They have to complete a project in groups, like a thesis. They have to have an academic advisor that they meet in their room. All groups, student groups, have their own room where they stay together in half of the day, and they have to document their work in a project report. So this has been the challenge, to change this sitting together all day, working together, into a digital way of doing it. Now, you didn't hear Sebastian tell you about it, but he actually was very glad and had found out to do that from his kitchen, as you saw it before. We have had a lot of innovation at the university, of course. One of the examples was that I think in 2 weeks, some of our researchers, they developed a ventilator that was ready for the world, and we put it out in open access so that everybody, if they had normal tools in the laboratory, they could make their own ventilator. And we have put that out in open source. So this is one of our examples of innovation. What we have learned about this time is that we are able to change very fast. Everybody says that they have learned to work more together with other people that they normally didn't work together with. For example, I have had more meeting with Habib from Jeddah many times. It's as if as I can call him, I know that he's in his office most of the time. So it's, you are more allowed to contact your friends around in the world. We are a rich welfare society. Denmark is a rich country, so it was easy for us to change because all our students have their own homes, they have their own computer, and they have access to Wi-Fi. So therefore, it was not so hard for us to change the situation. This time this will hit our economy. It has hit our economy here in Denmark because we have closed our country down for 2 months, and it also has hit Aalborg University because many of our research plans, they stopped during the period, so we had to pay for the researchers even though we didn't get external funding for them. So there are many ways that this has hit our university. So we have to find out how to deal with that. The most important thing we have learned from this is that we can teach distance learning, and that we have changed very fast. Of course, like everybody else, we have found out that we don't have to meet so often at the university. So meetings also inside the university in the future will be more online. In Denmark, just to say something very different from you or many countries, we don't wear masks. Our health minister says that we are not supposed to wear them until it's proved that they help. So and we don't have never taken temperature. So we look forward to find out some research to show that if it's necessary to do that. So, but our students is still at home. They can come back at examinations, and we think that we will open up our university fully when the next semester start at the 1st of September. But until then, it's open only for examinations. And thank you very much. This is the end of my presentation. Thank you.
Thank you, Birte. Thank you very much. Yes, we all learn new things very quickly. And thank you also for your last remark. Denmark is a very nice reaction. And thank you for sharing with us your action. Now, time quite quickly. I don't know if Hector Perez is here. Otherwise, if it is fine also for the organizer. If I don't hear from Mexico, I will ask the speaker to help me to close this section. We have a certain number of questions, which I will try to summarize because they are very, they share some common point. And we won't have time, I believe, to make another round table. So voluntarily, one of you can switch on the video and help me to answer to the question. So there are several of them, but one set of questions deal with something that you have already mentioned, and Dario Liberona for sure. It's about the motivation. I mean, it is clear that this new emergency way of teaching online or distance teaching, better, online teaching or distance teaching, has some restriction and probably can decrease the quality of the education. So the questions are about how to keep this quality of education high, and how to manage the student perception. They feel that the quality of education is decreasing because of virtuality. Or again, which is close to motivation, how we can keep student motivation high. Most of the time they are at home, they lose the social interaction and the social life of university and campus. I hope not for too long. Even in Italy, we want to restart after the summer because we think this is another point. And another question which is related, how we are ready to welcome back the student again, how to keep their motivation high during virtual teaching, is also a focus about international students. How in our university we are able or capable, or we forecast to have the student enroll again, and if you have some kind of measure for regarding the registration, particular protocol for international students. So the first round of question is about the student and the impact on online teaching and how we handle the international student. And how we handle the motivation, how we manage to keep high the motivation of our students. I hope you hear me well, that my English was correct enough. So now I invite any of the speaker voluntarily free to say something about this topic, the impact on the learning of our students and how we handle them. Anyone, please? Dario?
Hi. Dario already talked about this, but I think for universities that were not, that are not experienced in distance or remote learning, it's a really challenge. But I think a key issue is to train the faculty on pedagogical tools to help the students. So for maybe universities that have more experience can say about something about that. But I think a key issue would be training the faculty and how to keep them engaged. Because and then after the first semester, I guess we'll have some data in how to measure the learning outcomes. But maybe Dario, I think that you have more experience in that area.
Yeah. Yes. Two aspects. First, in regarding how we were prepared to receive the students, we have plans now in August. We're gonna meet because there's still a lot of variables that we don't know. So we're gonna have a special work to deal with that. There's a lot of ideas of how to do some activities with the students that are gonna be there, how to include the students that are in other countries, because we already know that we're gonna have this sort of blended system. We're gonna have remote students and we're gonna have local students. And I think what you're saying, it's very important, the training of the teachers. When we did the surveys, we realized that some of the professors were very engaging and students were very happy with the online modes. And we have other teachers that have very low scores in terms of their experiences. So one way that we're trying to deal, and I was asked to do this with other teachers, is to try to blend teachers, meaning that you have these very engaging teachers with other teachers that are not so much, so they could work together and train each other, because it's difficult for a teacher to get training from other students or technological people. They're a lot more open to have training from other teachers that they respect and they know, and they at least know that they understand each other. So I think there is a lot of, and you say in your presentation too, there is a lot of opportunity for collaboration with teachers. And saying that, there's also, we have a big chance now to bring to our classrooms some of the best professionals or experts in the world. It's super. In my classes, for example, I invited a friend of mine. He's an entrepreneur that lives in New York. He's from Harvard, the US, very, very busy guy, but he dropped into our class. He moved to Puerto Rico because of COVID. So he did the class. He can drop 15, 20 minutes from anywhere in the world. And we have this great chance of enhancing motivation with student in terms of bringing people that's very interesting for them. The students really appreciate that, because there is a lot of worry, especially from students that are finishing. What's going to happen with the job market? We have not addressed or talked anything about the finances of how our countries are going to support. We have now the case of Denmark, which is a wealthy country, but then we have cases like in Chile or Ecuador or other countries that are not so rich, so the economy is going to be very bad. But there is also industry. One of my students, he's a pilot from Finnish Airlines, and he doesn't have how the industry is going to go. 98% of the flights went down. So they're a lot worried about what's next after the learning and their graduation. So to keep them motivated, we have to keep them informed. We have to do more engaging classes, and we have to address what's happening in the world and how we can help them to continue with their lives and their future work. So we have to relate more to them. And as someone was saying, online teaching is not so much about the technology or the content, but it's also about the whole experience, that they could have a good experience. So there's a lot of ways, and there's a lot of material how to motivate students on these stages. And if we think of our surveys, 22% of the students say that this was better than face-to-face classes. And the reason they answer that is because their teachers were better than they were used to using the technology. So there is a big opportunity to motivate students and address what's happening to them. I think we're going to need some help from these mental health specialists too, in order to design our courses.
Thank you, Dario. Also in Italy, we have a survey about student and their reaction about this distant teaching. It's quite interesting. We had a couple of several unexpected answer also about the intensity of interaction of a student with the teacher, which in some situation increased with a distance learning. Well, but this has a reason. Let me ask first of all, is one of our speakers want to say something?
Yes, please. I may
hear a voice.
Please. Habib, can you hear me well? Hello?
Yes.
Yes.
Please go ahead. Yes, we hear you. Habib,
we are here again in the region. Maybe we are facing a different issue. Is the type of e-learning. Like I told you before, that KU has a huge experience in teaching online distance learning, and we have experience of 10 years almost, with more than 110,000 students yearly in all distance learning. But this type of teaching that we have this year, intensive online teaching, where students have to stay at home, they have this pressure of the whole idea of the epidemic, that they can't go out, the tension that they were feeling, and you have to teach them at the same time. many of the academics ask us to have a workshop or psychological way to understand how they have to return back to the university later on to the classroom, to understand how they have to deal with the students. Same happened with some of our students that they have said, we don't know what we shall do now. Shall we stay on distance learning? They are not asking because they are doubting between the quality of distance learning or face-to-face or regular learning. They are doubting about how is life now outside, how I have to deal with people. How, shall I stay next to my classroom mate in the classroom? Shall I say hi? Shall not? How I have to deal with this? So we've found that there's a huge also pressure on our students and on our academics that we have to fight now in this summer to know how we have to deal with it before the fall comes, and we have to stand back to real life, which is still, to be honest, not clear for us how it will be and how we have to deal with it. So this is from our perspective, again, because maybe we had past experience on online and distance learning. I'm not talking about the quality of teaching or the classroom or how the teachers was spreading their information. It was completely different experience for them. It's not the same that, okay, I have my classroom right now. I can take it whenever I want. I'm now going out with my friends, return back to home. I will hear some classes in the afternoon, night. No, I'm staying at home all day, and I have nothing to do else more than hearing my professor doing my whatever it is, homeworks, and hearing this news, which is like giving me more pressure, and it's not healthy life that they had during this situation. So I would like to hear what other universities are dealing with for this issue.
Thank you, Habib. Let's see if there is some other comment. Yes, I'm optimistic. I mean, students went through a very tough period in the last 3 months because of a lockdown and because of the reason you said, also here in Italy. But yeah, it's hard now to predict the future, but let's be optimistic that they will start again to live the life of the campus and start to interact again, even if with some restriction. We already see some sign here in Italy. Any other comment, please? Any other from the speaker want to share this experience about motivating the student? Please, who is speaking?
Yeah, it's a University of Szeged in Hungary. Okay. I'm Daniel Cash. If I may, just an observation on connected to what Dario also said, these huge possibilities and opportunities in this online education. We also had how to say, in our case, what was a very good thing that many different materials could be incorporated in the classes and in the sessions, in the online teaching methods. For example, one thing that was very useful and productive was this Coursera platform, where we had the chance to visit or incorporate, materials from world-leading universities like Yale and I don't know what other universities, but many universities on subjects and on things that that could be inserted in classes or so. So this is one example of how motivating it can be to have these online resources and online opportunities for students about which they can be informed in information letters, in circulars, and that can also be a good point of motivation or resource for motivation. Apart from, of course, the online contacts with all the teachers, the more contacts maybe sometimes than when classes were not online, because in online mode, maybe they can chat more and ask more sometimes. This is one of my personal impressions, because I had classes too, and we had maybe sometimes more conversations. Thank you.
And one more thing that I have realized Sorry, just one more thing, that for the students, it's a huge opportunity that lots of teachers learned how to record and share her or his lectures, and the students can see more than once the lectures, and it can be enhanced their result at the end of the semester.
Thank you very much. Sorry, I interrupt you? Okay, thank you very much. And I agree with you about the more interaction of the student. I have an explanation for that, but for sure it is very, this new scenario that even the student has to face open them to new motivation and also to new frustration. And in Italy, we share this also. And now we are facing what is going to be in September. And of course, as you already said, behind the health crisis, now we have an economic crisis. And I'm sure it's the same also in South or Central America. It is for sure true also in Italy, because after the summer, a lot of family will have a different economic scenario, and having people's daughter or son going away, going on the other region, renting a house and going to the university, and university, it won't be so trivial. And using this blinded teaching, which will be probably a mixture of having the university at the heart, at the engine of innovation and reaction to crisis inside each country. In Italy, at least, it's like it has been like this. I know it has been like this also in your country, about teaching, about what we are doing research, what we are doing towards society. So it's very, very nice that the university in the emergency reacted like that. And I'm sure they will be the core of the Renaissance, the core of going back to normality, whatever this means. Thank you very much for your time. Sorry for my last word. I think we can close it now. I thank you, and I thanks all the listeners and all the participating to this meeting. Thank you again, and thank you for participating here. Thanks.
Thank you
Ciao.
so much,
Thank
Nico,
you very much.
moderator
Thank you.
today.
Thank you very much.
Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Hello.
Thank you very much. Bundle of thanks
Perhaps
for
before-
nice
Saludos a
presentation.
todos mis hermanos hispanos. Bendiciones a todos.
Okay, perhaps
Stay healthy, and I hope to see you.
Thank you very much.
Maybe Pak Junaidi, please make an announcement.
yes, please, before you all leave, hello, can you hear me?
Mute semuanya dulu. Yeah.
Yeah,
Yes, please.
before we all leave, first, thank you for all the speakers for the inspiring work. To let you know, our network is still active during the pandemic. We move all the event online. So in case you would like to do national workshops, please let us know. We can do it online for your country. Secondly, we would like to invite you to start working on the questionnaire of our ranking this year. So if you have questions, please do let us know for that. So thank you again to all the presenters. So we have the timeline here for the questionnaire. Sabrina, can you move to the next one? Okay, so we will be waiting for your completed questionnaire by October the 31st, and we will hopefully announce in December. We may not be in the same boat, everybody, but we are in the same storm. We hope we can go through this storm healthily. So please stay safe and healthy as we continue our life. And may I remind everyone to show your face so we can have a group photo on the webinar. Thank you.
Bye.
Okay, photo first, please.
Bye.
Photo first, please. So show your pictures. Thank you all for joining us.
Thank you. Bye.
Okay,
Thank you very much.
Thank you for all speakers.
Thank you very much.
Thank you.
Bye.
Thank you very much.
Bye. Allah Hafiz.
Thank you very much.
Okay.
Stay safe and healthy.
Thank you.
Please share the group photo via our email kindly, please, if possible.
Yeah, we'll put it on the website.
Okay, thank you very much.
You're welcome.
Thank you very much everybody, Prof. Riri, Bu Agustin, Pak Jawainaindi semuanya, Pak Mirko, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much. From the Universidad de las Américas, Puerto Rico. Thank you.
Mbak Sabrina.
Nuhun, Bu Sabrina, Mbak. Nuhun.
Malam Bapak Ibu, Assalamualaikum.
Pak ya, lab ya.
Malam, Prof. Ambar.
Thank you very much, Ms. Fitri Sari. Both webinars are very excellent, and your efforts and as well as your team efforts are very remarkable. Thank you very much for holding such a organized and informative webinars. Thank you very much. From